Assalamu alaikum and welcome to Unlock Pharma with Dr. Umair. Today we are going to start the pharmacology lectures in detail. First, we have to know that what is pharmacology. So it comprises of two words, pharma and ecology. So actually the study of drugs lies under the pharmacology. In pharmacology, we discuss the drugs in detail, their uses, their application, their side effects, each and everything are covered under the topic of pharmacology. Today, we will discuss a very important topic which is known as route of drug administration. हम ड्रग लेते हैं, किस रूट से लेते हैं, उस रूट पे ड्रग लेने की जरूरत क्या पेश आती है, क्या वजह है कि हम एक स्पेसिफिक रूट को टारगेट करते हैं और उस पे हम ड्रग को लेते हैं या डिलीवर करते हैं. सो हर रूट जो हम यूज करते हैं उसकी स्पेसिफिक रिक्वायरमेंट होती है अकॉर्डिंग टू दी ड्रग्स. अब हम रूट ऑफ ड्रग एडमिनिस्ट्रेशन बेसिकली डिपेंड करती है दो पॉइंट्स पे. एक है कि डिपेंड अपॉन द प्रॉपर्टीज ऑफ ड्रग. जो हम ड्रग बनाते हैं उसकी बेसिक प्रॉपर्टीज क्या है. आइदर द ड्रग इज लिपोफिलिक या हाइड्रोफिलिक. क्या प्रॉपर्टी है उसकी, उस प्रॉपर्टी के बेस पे हम डिसाइड करते हैं कि हमने कौन से रूट पे जाना है एडमिनिस्ट्रेशन के लिए है. और दूसरा है ऑब्जेक्टिव ऑफ द ड्रग. और जो ड्रग हम यूज करते हैं उसका मेन पर्पस क्या है, ऑब्जेक्टिव क्या है. ऑब्जेक्टिव से मुराद क्या है कि नीड्स फॉर रैपिड ऑनसेट, कि हम जो ड्रग यूज कर रहे हैं किसी भी स्पेसिफिक डिजीज के लिए तो उसका ऑनसेट क्या है, रैपिड ऑनसेट रिक्वायर्ड है या नहीं रिक्वायर्ड. एक तो ये हुआ. दूसरा लॉन्ग टर्म ट्रीटमेंट, कि हम जब ड्रग यूज करते हैं तो प्रोलॉन्ग ट्रीटमेंट होती है, लॉन्ग टर्म के लिए हम एक स्पेसिफिक ड्रग को यूज करते हैं. तो ये सारी कंसिडरेशन हम माइंड में रखते हैं और उसके बेस पे फिर हम जाके एक स्पेसिफिक रूट को आइडेंटिफाई करते हैं कि भाई इस रूट पे अब जाके हमने एक स्पेसिफिक ड्रग को डिलीवर करना है. अब हमारे पास मुख्तलिफ किस्म के रूट ऑफ एडमिनिस्ट्रेशन हैं. तो उसमें पहला है इटर्नल रूट. एज द नेम इंडिकेट, बाय माउथ. अगर हम ड्रग लेते हैं तो हम ओरली या मुंह के जरिए जब हम ड्रग लेते हैं तो उसको हम कहते हैं कि इटर्नल रूट. इन द फॉर्म ऑफ टेबलेट और सस्पेंशन और कैप्सूल, जो भी डोजेज फॉर्म होगा वो जब हम मुंह के जरिए, माउथ के जरिए हम उसको एडमिनिस्टर करेंगे तो ऐसे ड्रग डिलीवरी सिस्टम, ऐसे रूट को हम कहेंगे इटर्नल रूट. अब हम इटर्नल रूट पे क्यों जाते हैं, जैसे मैंने बताया पहले कि कुछ स्पेसिफिकेशन या कुछ रिक्वायरमेंट्स होती है जिसके बेस पे हम जाते हैं और एक स्पेसिफिक ड्रग को सेलेक्ट करते हैं. तो फिर हम जाके एक स्पेसिफिक रूट पे उस ड्रग को एडमिनिस्टर कर देते हैं. नाउ व्हाट इज द नीड फॉर इटर्नल रूट. देयर शुड बी सम एडवांटेजेस which compel us to deliver the drug or administer the drug through eternal route. There are certain advantages which are listed as they are more convenient, easy to take. There are no specific requirement or specific handling requirement for taking the drug through eternal route. Secondly, these type of drugs are economical. If we are buying specific type of tablet as compared to injectable, so the tablet will be economical as compared to the injectable. So this route is specifically economical. Drug may either be swallowed or placed beneath the tongue. So by eternal route or by convenient, we mean that either we will take the drug or we will swallow the drug or we will keep the drug beneath the tongue for absorption. So these are specific points which are kept in consideration by for taking the medication through eternal route. Now there are different types of eternal routes. We will discuss all the eternal types of route in detail, in which we have number one, oral route of drug administration. Oral route, as the name indicate, we will take the drug by mouth. Now, what are the basic advantages of internal route? So these are listed here as easily self-administered. Everyone can administer the drug easily, or they can handle the drug easily when taken orally. Secondly, toxicity can be controlled. How toxicity can be controlled? By taking the drug orally, you can take a specific amount or calculated amount of drug to treat a specific disease. That calculated amount of drug is designed in the form of tablet or in the form of capsule. So when you are taking the capsule or the tablet, so you are actually taking the drug in a calculated amount in order to avoid specific sort of toxicity that are related with that type of medication. So toxicity can be controlled, or in other words, in case if there are some sort of toxicity occur, so we can control those toxicity by giving their patient a specific type of antidote, that is activated charcoal, to wash the stomach. As the drug is taken orally, it will reach the stomach. After reaching the stomach, if toxicity occur, we will wash our gastric lavage, we will wash the stomach, or we will give specific type of antidote to counter that specific toxicity of that specific drug. Although the pathway is complicated, how? There may be certain processes, or if you take a drug, there may be acidic environment, there is basic environment, so the absorption is complicated because of these specific type of environments in the GIT. So these are specific consideration or specific advantages of oral administration, and we prefer oral administration because of these specific type of advantages. Now, in order to overcome this complication, that is the complicated pathway which is caused by the acidic medium or basic medium, whatever it may be. So we have to overcome that specific type of condition. So to overcome that specific type of condition that are undesirable, we formulate the drug in two types or two form, that is enteric coating, and the other one is extended release formulation. Now, what is enteric coating tablet or formulation? So enteric coating formulations actually a chemical envelope that protect the drug from acid action. Whenever we coat the drug with specific type of chemical that can resist the action of acid, so by this means we can protect the drug in the acidic medium and transfer it safely to the basic environment. So enteric formulation are formed to overcome this complicated pathway. Use for drugs that are acid labile. Acid labile means those drugs that are degraded by the action of acid. So to prevent those type of drug, we will formulate enteric coated formulation for that specific drug to protect it from the action of acid. Also, for the drug that cause irritation. Now, if there is certain type of medication that cause GIT irritation, so in order to how it causes GIT irritation, by direct contact with the mucosa, the drug actually cause irritation of the GIT mucosa. So in order to protect the drug from causing the irritation, we coat the drug with specific type of chemical, and this coating is actually known as enteric coating formulation. Now the second one is extended release formulation. As the name indicates, extended release means slowly release of the drug at the specific target site. Now what is the need for extended release formulation? There are certain needs for any sort of formulation which we are going to formulate. So as in the case extended release formulation, special coating that control the drug release. Now those drugs that have a short half life means that they will easily be absorbed and excreted. So in order to control the release of those type of drugs, we formulate those drugs in extended release formulation, doseless formulation. These extended release formulation are doseless formulation. What does doseless formulation means? Doseless formulation actually means that we are not required to give several dosage to specific patient if we are using the extended release formulation, because in extended release formulation the release of the drug is controlled and a therapeutic dose is added to the extended release formulation. When a therapeutic concentration or therapeutic dose is added to the extended release formulation, and it also controls the release of that drug, so there is no need for repeated dosing. So this doseless formulation means that extended release formulation doesn't require repeated dosing for a day or for a month. Use for drug having as I already explained, that extended release formulation are actually used for those drugs that have short half-life. For example, morphine, which have a half-life of 2 to 4 hours. Now, this short half-life, which is 2 to 4 hours, required repeated dosing of the morphine to attain or to gain its therapeutic action. Means we need 6 dosage or 6 times a day. The morphine is required 6 times a day in order to achieve peak concentration, peak plasma concentration to produce the therapeutic action. Now, if we formulate the extended release formulation of the morphine, then we only require 2 doses per day. Now, look the difference. Here, in immediate release drug or the drug having short half-life, we require 6 times a day morphine. Now, in extended release formulation, as the release is controlled, we only require 2 doses per day. So these are the basic advantage of extended release formulation. Now the second one is sublingual or buccal route, which is also a type of eternal route. Sublingual or buccal route is also a type of eternal route. Now what is sublingual and what is buccal route of drug administration? So sublingual route is actually that type of drug administration route in which involve the placement of the drug beneath the tongue. We take the drug, place it beneath the tongue. Through capillary action, to capillary absorption, the drug will perform or show its therapeutic action. Now what is the buccal route? In buccal route, the drug is placed between the cheeks and the gum. So these are two different types of drug administration routes which are under the heading of eternal route of drug administration. Now, why we are focusing on sublingual or buccal routes? There are certain advantages which force us to use the sublingual route of drug administration. This includes ease of administration. Easily we can put the drug between the gums and cheeks, or we can place the drug easily beneath the tongue. There are no difficulties by placing the drug beneath the tongue. Rapid absorption. Rapid absorption, there are certain capillaries present beneath the tongue. When we place the drug beneath the tongue, through capillary absorption, the drug will reach to the specific target site and perform its therapeutic action. Bypass stomach. As evident, we are placing the drug beneath the tongue. So by placing the drug beneath the tongue, we are actually bypassing the stomach. Avoid first pass effect. If we are avoiding or we are bypassing the stomach, we directly bypass the first pass effect, as first pass effect occurs whenever we take the drug orally, and hepatic circulation, all these occurs. So in sublingual route we avoid the stomach and we avoid the first pass effect. Now, very important one, the parental route. Now, what is parental route? Parental route is that type of drug administration route in which we directly administer the drug into the bloodstream. By injection, we directly add the drug to the bloodstream. For drug, now why we are using parental route? There should be some sense behind using the parental route of administration. So for drug that are poorly absorbed in stomach. Now if a drug is taken orally and it reaches the stomach, if the absorption of the drug is poor in the stomach because of acidic environment or any other factor, we convert to the parental route, because here in stomach, for example, heparin. If we are taking heparin orally, the absorption of heparin will be lower in the stomach. So if the heparin absorption is lower in the stomach, we will administer the drug parenterally to achieve a specific maximum therapeutic effect. Patient unable to take drug orally. Now there are certain type of patient which don't show compliance to the oral administration, or they may be unconscious. So because of this condition, the patient is unable to take the drug orally. So if he is unable to take the drug orally, then we shift to the parenteral route. One of the most important and advantage of the parenteral route is rapid onset. As you inject the drug to the bloodstream or add the drug to the bloodstream, the onset of action begin. And secondly, irreversible. As here in oral route, toxicity can be controlled. We can give them certain type of activated charcoal to wash the stomach, but in parenteral route, if in some cases toxicity occur, then it is very difficult to reverse the action of that specific drug. Now there are different types of IV routes through which we can administer the drug to the patient. There are different type of parenteral routes to which we can administer the drug to the patient. One is IV, which is the most common type of parenteral route. It has a specific advantage, and that is 100% bioavailability occurs in IV route. All these factors also applies on IV route, as it is irreversible, onset of action is fast, for drugs that are poorly absorbed in the stomach, directly administered to the bloodstream. So these are the advantages by which we are shifting toward the IV route. Second one is intramuscular route, injecting the drug into the muscle. So the drug delivered as a solution, the drug are delivered in the form of solution or depot that are injected to the muscle. So from there the absorption is rapid. And the next one is subcutaneous route of administration. So subcutaneous is actually like that of the intramuscular administration, in which we administer the drug, but it is slightly different than that of the IV, because in IV the bioavailability 100%, onset of action is quick. So in subcutaneous route, slower absorption occur, and it's also minimize the risk of thrombosis. What is thrombosis? Formation of clot. So a risk or a disadvantage of IV route is formation of thrombosis, while subcutaneous route avoid, or subcutaneous is advantageous over the IV route, because of no risk of formation of thrombosis, which clot the their clot will finally block the arteries, and severe damage will occurs. Now, these are the basic route of drug administration which I explained in detail. Now, beside these routes of administration, there are also several other type of drug administration routes, which includes nasal preparation. Through nose, we administer the drug aerosol spray. We administer the drug in the form of droplet, and absorption through the large surface area. Absorption increases and the therapeutic effect is shown topical by applying the drug. So topical administration is intended for local requirement or local therapeutic effect. We apply the drug or cream to a specific target site which is locally, and that drug will show its therapeutic effect. Transdermal, rectal, vaginal. So these are other several type of route of drug administration that can also be used. So this was all about the first lecture of route of drug administration. If you want to take a screenshot, you may take it from the board. For more videos, subscribe Unlock Pharma with Dr. Umair. Thank you.